Welcome back to the Glow Up.
Thank you for having me.
Yes, today we're going to be talking all about hormones, but more specifically a hormone that women are taught to ignore, which is testosterone. If you are feeling flat or foggy-headed or undermotivated, or you struggle to build muscle at all, or you notice that your libido is just disappearing, it might not just be estrogen. It could possibly be free testosterone. Am I right?
That is correct.
Today we have Dr. Alistair McAlpine from FemLabs and AndroLabs to unpack why testosterone actually works for women and why free testosterone matters so much and how to approach it safely. Thank you for coming back and joining us again. I'm so excited. I really am looking forward to diving into this topic. So just a bit of a history for everybody. In our last episode, we spoke about GLP-1s and we were talking about hormone imbalance and how it impacts a woman during menopause, perimenopause. I mean, there's so many different ways of explaining it. Peri, pre, post. I mean, at the end of the day, it just really sucks all in all.
Pretty much. Yeah.
And Dr. McAlpine explained to us that, well, there's a bit more to it and GLP-1s are not for everybody and you should be checking your hormones as well. So I went and did a little hormone test with FemLabs, which I must say was such an easy process for me.
Great.
I know that I'm a very tech-forward individual, but, you know, you can be a little bit nervous doing consultations online. There's a lot of questions. And I think when I thought about it afterwards, I realized, well, at the end of the day, if I'm sitting in a doctor's practice, you're going to ask me the same questions in any case.
Exactly.
So let me just document it properly online. And I must say, the part that catches me when it starts asking you about rating your average eating habits, right? And you go, no, I actually think my eating habits are like, I'd say an 8. I do quite well until you requested to dive a little deeper. Yeah. And then you're like, okay, I'm not going to lie. I'm sitting at about a 4. Yeah. But anyway, we're going to try. So I was struggling with just fatigue from around 2 o'clock, getting tired. I mean, I'm 37 years old. Okay, so I'm not quite in the menopause bracket yet, but pre-menopause can start at around 35, right?
Correct, even earlier.
And I'm not menopausal, okay, because I did my blood tests with FemLabs, but nonetheless, I was struggling with fatigue from about 2 o'clock, just having that horrible dip, always struggling to lose weight, no matter how well I think I'm eating. I do weight training 3-4 times a week for an hour. I do cardio every single day for about 30 to 45 minutes. And I should be a supermodel, seriously. So just decided, you know what, not everything is about cortisol. We had that discussion as well, where you said, cortisol is not everything. And I was like, really, it's not everything.
It's not.
But it's not.
Everyone blames cortisol. It's not.
Everyone blames cortisol and insulin. So I went for blood tests before FemLabs. Yeah. And my insulin levels were fine. And my cortisol, because you think cortisol, insulin, thyroid, yes, right? 100%. That's the go-to.
Yeah.
So I did that. That all came back clear. But then we had our chat the last time and I went on to FemLabs. I did the questionnaire. I got the blood form from, I think I chose Lancet. Quickly, it was so easy.
Good.
It just emails it through straight away. Took the form to Lancet and did a blood test where I tested various hormones, which you can explain in a bit exactly what we test for. Yep. And it turned out that my free testosterone was a bit low. And I was like, okay, well, you know what? Trust the process. Let's see what happens. So I reached out to Dr. McAlpine's team and it's very cool that the blood results get to him very quickly. I mean, my pregnancy tests weren't even that quick. So
we tried.
So he got onto it and responded to me pretty quickly and told me exactly what I needed and why. We had a bit of a backwards and forwards discussion about it, you know, so I think it's very important that you do question things this is now to the
course.
audience. You got a question.
100%.
If there's anything you're not sure about, go back, ask. Don't just take everything at face value. But having said that, I started my journey. So it's been, I'd say 6 weeks, because there was a period of time where I started the testosterone cream, very low dose, put it on the inside of my arm over here. And at the start of it, I like went through this like a wave of having these little heart palpitations and feeling like my body temperature was rising. I am a unique candidate to anything when I'm busy testing skincare products. And it says for sensitive skin, I'm like, really, let's see, bring it here. Yeah. So, you know, at the time, yes, I was struggling with fatigue. I was struggling with not being able to lose weight easily, especially around my stomach. Not having that much energy, just feeling so low and tired and like foggy brained. Apart from that, having random panic attacks in the middle of the night for no reason. No, there's no emotional reason as to why I was feeling this way. And this was for about 6 months prior. I would just wake up in the middle of the night, especially if I had like sugar after 4 o'clock. I remember we had a whole chat about that. And so I started the testosterone cream process then. I had to take it gradually or start gradually. Eventually my body got used to it. And within about, I'd say 3 weeks, I just started feeling amazing. So just more energy. I mean, I was just saying that I'm not too fazed about the weight loss situation. I'm more interested in how I feel physically. I have so much energy to play with my kids. We go for runs. I never used to run. I would do cardio, but no running. My weight training is improved. I feel so clear-minded, like the mental clarity part of it. It's just, I never anticipated that from literally a testosterone cream. So everyone, just so you understand my journey, that's why I find this topic so super interesting. And I want to unpack it for the sake of answering questions which women might have, whether they're suitable candidates or not. Are there risks? Is it going to cause breast cancer? I mean, these are obviously all topics of discussion
100%.
Around hormones. So most people think testosterone, just a male hormone, only important for men. What does testosterone do in a woman's body beyond just libido?
So testosterone is probably one of the most underrated hormones when it comes to a female patient. So you'll see it like if you go to the gynae or even the GP, a lot of the time they'll just check your estrogen, your progesterone. They don't even check your testosterone levels. So there's a lot of misunderstanding around the importance of testosterone. So it's obviously not just about libido. As you mentioned, you literally ticked all the boxes there of a patient with suboptimal low testosterone.
Yeah.
So important for mental clarity, vitality, energy levels, gaining or maintenance of muscle mass, just that general feeling of well-being, basically. It's a driver that basically controls so many aspects of your physiology, but it has obviously positive benefits. So it's more than just that. So it's very important, obviously, to look at the patient in context as well. But, you know, a lot of these patients have those feelings of just fatigue. I'm tired all the time. You know, there's no motivation. As you say, the mental clarity is not there. They forget things all the time. And everyone just puts it down to, oh, well, maybe you're just tired, especially when it comes to female patients, because, you know, a lot of women have that role of, you know, the busy working mom, basically, you know, running around after children.
Always on the go.
Keeping your husband happy, all those things, always on the go. Meanwhile, you know, you're just tired. You just need a really good holiday.
Yeah, that 50s housewife, but still got to be an independent
100%.
working woman.
And that's where a lot of the times it's actually just your testosterone that's low.
Sure. So how does it influence your brain function or your mental clarity or your metabolism? So
one of the things that, and you know, it's still one of these things where they've got pretty clear pathways, but still like more evidence coming up. But sort of the general, and I keep it very simple, thing when it comes to brain function is dopamine, basically. So there's a link obviously between optimized testosterone and dopamine production and secretion as well. So dopamine is one of the key drivers for, say, motivation, mental clarity. So it's just that pure sort of like dopamine release, but also neuroplasticity as well. So you see it in younger kids, right? So kids going through sort of their teenage puberty years, right? Both boys and girls get spikes in their testosterone levels. That's when they have neuroplasticity. That's when you see their mental acuity. They're learning stuff. They're learning how their bodies work, but they just do it in such a quick fashion. You see the way a child picks up something like that because of the neuroplasticity side of it as well.
Okay, and what is the difference between total testosterone and free testosterone? Why does it matter?
It's a great question. So I get patients that come to me with the total testosterone value, and I say to them, I can't use that. It's useless, right? So total testosterone basically is the entire amount of testosterone that is floating around in your physiology. But what happens now, you get something called sex hormone binding globulin, so SHBG for short.
That was part of my next question. You're explaining it.
So sex hormone binding globulin actually binds to testosterone. So if a hormone is bound, it can't do anything. Becomes useless basically. So what happens now is that you get this small fraction of free testosterone that's not bound by sex hormone binding globulin or even albumin as well. And what this does is that free testosterone is actually the testosterone that can exert a physiological action in terms of that it can penetrate a cell membrane, bind to the nucleus of the cell, the structures in the cell, and elicit a physiological response. So that's why free testosterone is very important. But invariably, when you have your bloods done, the laboratory calculates your total testosterone, the sex hormone binding globulin, and from that, they calculate your free testosterone level.
And at what age does testosterone generally start declining in women?
So the previous sort of conceptions around this would be like, oh, well, sort of maybe patients in their sort of late 30s, that's when it's going to start. I'm seeing female patients in their late 20s now with levels where shouldn't be, they're super low or suboptimal for their age as well. And there's a whole bunch of factors involved in that, from chronic stress, lack of sleep, over-exercising. But the big thing actually is endocrine disruptors. So endocrine disruptors being stuff that's in our water that we drink every day, even the clothes that we wear, fragrances that we use, products that we use on our skin, how we even cook our food, how the food is processed. There's just all these things now that are causing massive issues, and mainly with testosterone, funny enough. And you're now seeing it, obviously the same is happening in boys as well, and young men, also low testosterone. Why? Endocrine disruptors. But there's a whole bunch of variables involved there as well.
So I'm right in saying testosterone is not just a male hormone, it's a human hormone, right?
100%. So there's this old school thought that testosterone equals man, right? That's it. But it's definitely not. It's a hormone of vitality. That's the best way to describe it. It's like the driver of the car, basically. Estrogen, progesterone are basically the passengers. Testosterone is like the driver. So that's why it's so underrated and such a key component to any hormone optimization or replacement program for a patient, but completely neglected.
So I'm right in saying that we focus a lot on estrogen, but testosterone is actually a totally underrated hormone that 100%. Needs to be considered in both men and women.
100%. If you look at a lot of the symptoms that come with a perimenopausal, menopausal state, 90% of those symptoms are actually testosterone related, right? Why? Because as your ovaries start to function less and less, ovaries actually produce small amounts of testosterone. So now your adrenals are trying to produce testosterone, but as you age as well, your adrenals aren't functioning as well. So that's why the testosterone starts to go as well. But it's key components. And I always get asked this question, if I could only replace one hormone in a female patient, what would that hormone be? It's testosterone all day, every day.
Well, I can vouch for that because that's the only change that I've made in my life. And look, I think every individual has their own biological makeup and they have their own list of requirements. In our last podcast, you mentioned that women have quite a long list compared to men.
100%.
But from my own personal experience, testosterone in low dosage has had the biggest positive impact in my life. Yeah. And you would assume that testosterone causes you to be more aggressive? Because if you go and look at all the, historical data on men using growth hormones and testosterone, they're also super aggressive. I must say, my family can vouch, I hope, but I think I feel more chilled.
So once again, it's a perception. So everyone thinks, associates testosterone with aggression, basically, because once again, the male hormone. You actually find in patients where you optimize the levels. Remember, optimization, I'm not trying to make you what we term super physiological. I'm not trying to make your levels too high. I want to get you to the higher end of what is normal. Let's actually get, once again, because your brain is functioning better, your neuroreceptors are functioning better, all those sort of happy hormones, dopamine, serotonin functioning better, you actually end up being more calmer and less irritable. So that's why also one of the symptoms of low or suboptimal testosterone, you mentioned anxiety, but irritability, and depression basically are one of the major, sort of the first symptoms that actually pop up where you should start looking at testosterone levels.
And that's more biochemical, not just emotional.
Exactly.
So what role does testosterone play in your quality of sleep? Does it improve your sleep? Does it help with recovery?
So sleep is an interesting one. So it should improve your sleep, but in some patients, it doesn't really improve their sleep because there are other factors to poor sleep as well. Sleep, there are so many variables involved in terms of where were the cortisol where was your cortisol levels in the day? So ideally, your cortisol levels actually have to be high in the morning and then slowly come down during the day. And that ramps down your brain, basically helps you sleep. But you have a stressful event during the day and your cortisol levels go up. Guess what's going to happen? That's going to affect your sleep, no matter how good your testosterone is. So ideally would help with sleep, once again, with all the effects it has on all those neuro sort of chemicals in the brain. Can help quite a bit.
Fair enough. I guess if depression and anxiety is being addressed with testosterone, then if that's the implicating
100%.
factor,
So it's what's the driver of the poor sleep. A big component of sleep as well is psychogenic. So if you've got a history of poor sleep and you go to bed worried about, am I going to sleep tonight? Guess what's going to happen? You're not going to sleep. So there's all those variables that you've got to take into account.
So women don't lose their edge just because they're starting to fall apart or they're failing. It's generally just their biology is changing, right?
100%. It's part of the aging process as well.
Women say, I'm eating the same, I'm exercising, I'm following the same protocol every day, but I'm just gaining weight and I just feel terrible about myself. Let's talk a little bit about that. What's your take on that?
Once again, related invariably to a hormonal imbalance. And one key driver, testosterone. If you look at what testosterone does from a metabolic point of view, helping with burning of visceral fat, also that motivation as well. So people say, okay, well, nothing's changed. My diet hasn't changed. My exercise regime hasn't changed. And I'm losing muscle mass and gaining fat. Sometimes the motivation may not be there to say, push as hard with your training or to stick to your diet as well as you think. So you sort of slide a little bit here and there, and that might be a contributing factor. But once again, it's the driver of the car, the key metabolic driver, testosterone.
Absolutely. And talking about visceral fat, how long would it generally take to start seeing an improvement on visceral fat when on testosterone treatment?
So that's an excellent question. The way I would reply to that is, how long is a piece of string?
Fair enough.
So it depends on your physiology and what you're doing as well. So, on average, if a patient is eating well, exercising on a regular basis, using their cream or their hormone therapy with us religiously, you'll see within like sort of a 4 to 6 month period that you're going to start to see significant differences. But if you're not putting the work in, and I always say the testosterone is not the silver bullet, but it's the catalyst that gets things going. So if you're on the cream, but you're not eating well, not exercising.
Can't go eat your pizza and drink
100%.
alcohol every weekend.
And then I get patients that get upset and say, oh, it's not working. But when you sort of do a bit of a deeper dive, they're not putting the lifestyle factors into play as well. You might have the lifestyle factors in play and it takes forever to get your end goal. But now, once again, if you require it and you optimize your testosterone, it speeds the process up. But it's not the silver bullet, so to say.
And what roles does testosterone play with developing lean muscle and regulating your insulin?
So, very interesting. What comes first, the horse or the cart, basically, the chicken or the egg? So, if you look at what controls insulin, right, it's actually muscle is the most important factor. So, if you now are able to build or maintain lean muscle, what's going to happen? Your insulin sensitivity is going to improve no matter what. Why? Muscle has more metabolic demands than adipose tissue, than fat. So if you build up your lean muscle mass, it's going to be far easier to regulate your insulin levels.
Okay, and just circling back quickly to visceral fats, is a decline in testosterone directly or indirectly related to developing visceral fats?
It's a good question. That's an answer that no one can really give a 100% confident answer to. But invariably, I mean, what I've seen with patients is patients with suboptimal low testosterone, their visceral fat is normally elevated. So it's a direct correlation.
I've seen a lot of TikTok videos and reels and posts about how muscle building is anti-aging and improves vitality. Can you tell me a little bit more about that?
So if you look at what the literature talks about now in terms of longevity, because longevity medicine's become a very popular topic nowadays. What is one of the key factors that controls longevity in terms of what can you do as a patient that's going to ensure that you have a healthy lifespan, right? Or health span, not just increase your lifespan. And every single study comes back to preservation of muscle mass. So if you look at a older geriatric patient, 70, 80, hunched over, unable to really stand, unable to really walk properly, unable to do things for themselves, what's the one thing that you see with those patients? They've got minimal muscle mass. They've lost a lot of muscle mass. So as soon as you can maintain or gain muscle mass, guess what happens? It's like your retirement policy, right? Retirement annuity. You've got to start banking it in your earlier years of life, right? So start banking in your 30s, 40s, because if you try and start banking for your retirement in your 50s and 60s, you're not going to have the full benefit. But that maintenance of muscle mass or the ability to even gain muscle is probably one of the best factors that you can do to maintain longevity, and based once again on decreased risk of cardiometabolic disease, decreased risk of neurovascular disease or neurological diseases such as Alzheimer's, dementia. As we get older, prevention of osteoporosis as well, or slowing down osteoporosis. One of the leading causes that kills older patients, they have a fall and they fracture the hip, right? I can't remember the numbers off the top of my head, but if you look at the correlation between hip fracture and overall mortality in a patient 70 and above, it's huge. Once again, you've now got that muscle mass, you've preserved your bone health. If you fall on the floor, you're able to pick yourself up. That has a huge significance for later on in life. So, yeah, vitally important.
So testosterone supports muscle,
100%,
which inevitably
supports longevity.
Yes.
Exactly.
So it's not so much just about libido. There's a whole other conversation here on longevity. If women suspect low testosterone, what should they be testing? What do you put in your test? What are the different markers?
So we keep it very, very simple. So obviously you want to check estrogen and progesterone because they have their role as well. But normally on the testosterone test, it's going to be your total testosterone, your SHBG, so the sex hormone binding globulin, and then the free testosterone level. Obviously, based on that, then I can assess the results and say, okay, you're either low or suboptimal. And this is what's very interesting. So the reference range for free testosterone is a very broad reference range. So a patient might come back, say, depending on which lab you go to. So I'll use an example, depending on which laboratory. So like, I want to mention names. One laboratory uses 55 picomoles per liter as its upper limit and 3 as its lower limit, right? So you might get, say, a patient in their 40s. We'll use a 40-year-old patient as an example, who does the test and the free testosterone level comes back at, say, 8, right? Someone might look at that result and go, well, you're within normal range, so you're fine. So it can't be your testosterone. And they literally tick every single box, right? But what a lot of people don't understand, that reference range, when it was developed, they took bloods from patients aged 18 up to the age of 80.
Okay.
So there's a big difference between an 18-year-old and an
Yes.
80-year-old. So
It's not necessarily age appropriate.
So you might be 40, but you could potentially have the testosterone age of a 70-year-old.
Yeah.
But you're still within normal range, so can't be your testosterone. It is your testosterone, you know?
My mother and I were actually joking about this topic because in your report you give us our
Testosterone ages.
testosterone age. My mom's a geriatric.
Yes.
Okay. According to her testosterone
Yes.
age, not according to her
Yeah,
actual
age.
age. I am well above my my actual age.
But
So we rip each other off. Don't worry, it's fine. We understand. You're 72. It's okay.
But you see, it puts into context of actually where you are.
Yeah, I get that.
As I say, and a lot of people look at that and go, oh, well, we're within normal range.
Mom's going to kill me for saying this.
So you're fine. It must all be in your head. It can't be your hormones. I don't want the testosterone age of a 70 or 75-year-old. No one does, right? I want to get you back to where you were in your like early 20s, late teens, because that's when you're getting all the benefits. And that's where obviously the aim of the therapy is to ensure that we don't make you what we term super physiological. I want to keep you within that
Normal
realm,
range,
but
yes.
towards the high end. So you get the benefits then without a side effect profile, because I think a lot of women have got this perception of testosterone and they think of, not to be disrespectful, a lot of female bodybuilders who used to use very high doses of testosterone and other anabolics, right? And they think of like deepening of voice and bad skin and squaring out of jaw lines and all those things. But those ladies used very, very, very high doses.
Yeah.
That's not the aim of this. We always want to get you to that physiological high value so you get all the benefits basically without a side effect profile. So you still look like yourself. You're not going to become masculinized. You then not going to have a deeper voice, all of that, but you're going to have the benefits of it.
So when you run your test, do you treat based on the number or symptoms or both?
Both. So at the end of the day, you're not just treating a blood result, you're treating a patient as well. So symptoms are very, very important. So if I've got a patient that's got suboptimal levels with at least sort of like 3 or 4 symptoms, they become a great candidate for the therapy. You might find that there's some patients that have an okay level that's appropriate for their age and still has symptoms. Do you then treat that patient and you say to them, well, listen, let's try the treatment. Let's see how you go. If you find benefit in the treatment, obviously do follow up blood work, monitor where you are, feeling great, let's leave you there. Because sometimes, there's a saying, if it looks like a duck and quacks like a duck, it's a duck, right? So you've got to treat the symptoms of the patient as well. But obviously the biomarkers, so the blood results are nice to have because that gives you your baseline of where you are. You can't just, there's testosterone cream for you and you and you. Yeah. Some patients don't need it. I get some patients that come, their levels are actually high or where they should be, or at that physiological high. They've got other symptoms. Is there something else going on?
Sure.
So, yeah.
What is the difference, or how would you differentiate on a blood result what is considered optimal and what is considered normal? What's the difference between optimal and normal when it comes to testosterone?
So optimal, I want to try and get you to where you were, basically where you were in your late teens and your 20s. That's it, right? Okay. Because you can have the benefits. But once again, it's looking at that range because it's such a broad reference range. So that's sort of the aim of the therapy, and that's where I said the follow-up blood work comes into effect. And everyone responds differently as well. It's not a one size fits all. Some patients, very sensitive to the therapy, very low dose makes a huge difference. Yourself. Some patients, you've got to use high doses, and even with a high dose, you don't get them nearly where they should be. So you've got to increase the dose even more. But that's obviously where a more tailored approach is very important as well. And the follow-up. And that's where with the platforms, I quite like it because we follow you up on a regular basis as well, which is very important because it's not a one-size-fits-all approach. It can't be a one-size-fits-all approach.
Absolutely. So if women suspect that they've got low testosterone, what are the symptoms that they should look out for? I know we spoke about some of them, but what's a typical low testosterone symptom list? So
I'll start with the big ones. So let's start from poor libido being the first one. Anxiety, irritability, depression, brain fog, lack of motivation, inability to gain muscle mass, Those are sort of like the big ones that come through. Other one that I get from patients is they just feel flat. There's no
no motivation at all.
The way they describe it is basically vitality is not there. So those are sort of the big ones to look out for. Poor sleep, as you mentioned as well. So those are sort of the big ones to look out for. And can be a laundry list of about 50 different things, but those are like
the main
ones that you need to focus on.
And if a woman's trying to assess whether she has too high testosterone levels, what would her symptoms be then?
So this is where...
Are there warning signs?
So warning signs, things like... androgen dependent, sort of like acne, basically. So especially like around the jawline, thinning of hair. There you might find someone becomes a little bit more like aggressive or super irritable because now you're on the other end of the spectrum. You sometimes see it with patients with PCOS. They've got slightly higher levels.
What is PCOS?
So polycystic ovarian syndrome. And you find that those patients invariably have slightly higher testosterone. But then you've got to look obviously at the estrogen, progesterone. Sometimes the estrogen is not where it should be, so you can supplement that and that can regulate the testosterone a bit. There are medications that you can use as well to basically bring down the testosterone if you need to, but those are very few and far between. But sort of those are the big things. It's more like physical changes that you'll see. And so the big ones normally acne, thinning of hair is like the two ones. Abnormal hair growth as well in certain areas of the body as well. So
that's strange because it's my understanding that increased testosterone helps increase hair growth. Or am I wrong with that?
So it depends. So when testosterone doesn't just stay as a static hormone in your body. It can go down various pathways. So the one is actually something called a process called aromatization. You see it more in men than you do in female patients, but it can happen in female patients where actually testosterone can become shunted basically into estrogen. Or you can get something called dihydrotestosterone as well, so DHT. So DHT, you hear lots, especially with men, if they've got DHT receptors in the hair follicles, that causes hair loss. Same thing with the female patients. Got DHT receptors in the hair follicles, that you got that sort of genetic propensity, so to say, for hair loss. Then that's when you can get thinning of hair.
So say I'm busy doing my testosterone treatment and I'm a bit anxious that I might have too high of a dosage. Is there anything I should look out for apart from acne, hair loss?
Best thing to do is just do a follow-up blood test. That's the best way.
Okay, so let's say we do the follow-up and it does show it's a little high. What do I do then? Does it go back to normal?
No. So what you then do is then, if you're on the therapy, we then just adjust your cream accordingly.
Okay.
So the beauty of what we do on the FemLab platform is use something called bioidentical hormone therapy. So basically, it's a cream that you apply. You mentioned you place on the inside of the arm. The reason for that, because the skin is quite thin there, it allows for better absorption. But the beauty of this is I can adjust the dosage or the concentration in those creams by 0.1% if I want to.
Okay.
So we can really, I can get feedback from a patient and say, okay, I'm concerned it might be a bit too high. Say we see on the blood results it's a bit too high. Great, let's dial it back a bit. Let's change your cream. And that's when we can see how you respond, potentially repeat the follow-up blood work sort of 2-3 months down the line, make sure everything where it needs to be. And that's the beauty of it. But remember, a physiological system's dynamic. It's never static. So with time, you sometimes might need to increase it again because you're saying, oh, geez, now I'm not feeling the benefits anymore. And that can happen a year, 2, 5 years down the line. We can then ramp it up. But once again, just do some blood work. And the blood work is actually quite important because, that's why that initial blood work is great, because you've got your baseline. And once you've got your baseline, you've got somewhere to work from, basically.
What gets measured gets managed,
100%.
Right? I live by that. Okay, so is it reversible if, for example, my testosterone skyrockets while I'm on the treatment and I'm starting to notice all these changes? Are those changes reversible? Yes. Are the symptoms reversible?
Yes. Yeah, it's one of those things that, and as I say, once again, these treatments aren't for everyone, right? Everyone responds differently, as you would know with your mom's history, right? Yeah. Everyone responds differently. So once again, if it's not for everyone. If you decide, or there's an issue, you stop the therapy, all those symptoms resolve. Because why? You go back to your baseline.
Okay, so you will go back to your baseline
100%.
eventually. So don't panic out there, ladies. If you start the process and you're feeling anxious, go do the blood tests. Do follow-up blood tests to see where you're at. If you do not respond well to it, it's okay. You will go back to
100%.
normal, so to speak, whatever that looks like. How often should you be repeating the blood tests?
So I look at how you're responding, because once again, we look at symptoms as well. So if I've got a patient started therapy, is feeling phenomenal, can't stop raving about the treatment, it's changed their lives, I can say to them, let's push the blood test out for 6 months' time, right? I've got a patient that started the treatment and the symptoms are resolved, but there's now some symptoms that are still there. That's when sort of at that 3-month mark, then it's a great time to do the blood test. Once again, because there's a cost factor involved as well. I would love it if patients could do bloods every month, right? I mean, from a research point of view, that would be phenomenal. But once again, it becomes expensive. So based on your feedback, based on your symptoms as well. So if I get patient complete symptom resolution, they've got no symptoms, they feel amazing, great. Let's do the blood test in 6 months' time. Let's see where we are.
So, sorry, carry on.
No, so it's very patient dependent, basically.
Okay, so the goal here is not to overdose and increase testosterone so dramatically. It's just to get the right percentage 100%. For your own physiological makeup.
And that's where the 100%, that's where the bioidentical creams that we use work so well, because even if it goes a little bit high, it's never going to get too high like you would get with an injectable testosterone. So I get some female patients saying, I want an injectable. And the answer to that is definitely no, because it's going to spike your levels too high and then you're going to land up with issues. So,
and it'll take longer to go back to your baseline from that point.
Exactly.
So one topic that most women fear when it comes to hormone therapy is the risk of breast cancer.
The dreaded C word, yeah.
Is there a high quality evidence that clearly links testosterone to increase in breast cancer?
Complete opposite, actually. So breast cancer, when you look at breast cancer, there's obviously estrogen is the big issue there. So you get some breast cancers that are estrogen receptor positive. That's where avoiding estrogen in those patients is imperative. But if you invariably look at those patients, shame because a lot of those patients have been through, it's either chemotherapy, radiation, guess what that's going to do to your endocrine system? It's going to cause havoc. So invariably you find the testosterone is very low. There's lots of studies coming out now showing a lot of safety with optimizing, and I'm using the word optimizing, not overshooting the mark.
Yeah.
Optimizing testosterone, being safe in those patients with cancer or with any form of breast cancer and even endometrial cancers. But what's interesting now is there's some evidence that's coming out now that's showing that there's a correlation between development of cancer and suboptimal low testosterone levels.
Okay.
So the sort of thought process that's coming out now that if you optimize your levels when you are younger, you greatly reduce the risk of developing, say, a breast cancer, endometrial cancer, actually any form of cancer later on in life.
Could you share that research with me so I can add it in a link?
I can try and find a few. It's something that I've obviously it's more talk for now and sort of preliminary stuff. But that's what is sort of coming out now.
Yeah.
And I'm going to use men as an example. I know it's about women and testosterone.
Doesn't matter.
Men as an example.
We are all equal.
If you look now especially in the United States now, if a male patient presents with prostate cancer and has suboptimal low testosterone levels, part of first-line therapy for that patient is actually to put them on testosterone treatment.
Okay.
It says something.
Yes, absolutely.
So there's some evidence that's coming out now. Once again, there are these conceptions about, any form of hormone therapy, you're going to aggravate cancer. No. Once again, if it's done correctly, there's monitoring there, there's guidance there. We're not trying to make you super physiological, keep it in that physiological realm, because invariably patients that have been through a cancer treatment, they've got all those symptoms, the fatigue, the brain fog, decreased mental clarity, just libido's low, no motivation, loss of muscle, because their physiology's been through hell. It's been bombarded with chemotherapeutics and radiation and repeated surgeries and all that. once again, now invariably look at those patients, their testosterone levels are on the floor. More than safe to do testosterone in those patients.
Could women who have a family history of breast cancer be at a higher risk of attempting testosterone treatment? I know what you've just said, but is there any risk of testosterone negatively impacting estrogen by increasing estrogen? I know it's a random question.
So once again, if you're keeping that within that physiological realm, the amount of estrogen production you get is so little, right? And when it comes to a family history of breast cancer, so if I get a patient that has got a family history of breast cancer or colon cancer, because colon cancer and breast cancer can be linked together, or even endometrial cancer, one of the first things I ask them is, have you been for the gene testing? Right. There's lots of gene testing that you can do that can identify you at risk, you're not. So I think Angelina Jolie is one of the most sort of like popular examples.
Yeah, she did the double
she had the prophylactic double mastectomy because she had positive BRCA genes, if I remember correctly.
Yeah.
I might be wrong, but I think that was
something along
those lines, right? So that's where the gene testing is very, very important. But once again, if you are respecting the physiology, right? And what I'm saying by respecting the physiology, respecting your testosterone physiology, there should be no increased risk.
As long as it's within a safe range.
Exactly.
So this is where evidence matters and not just follow TikTok trends and outdated assumptions, right? So let's do a quick myth or fact. I mean, you pretty much answered most of these, but for those who are listening and following the TLDR, too long, didn't read process, let's narrow it down for them. Testosterone makes women bulky.
False.
Testosterone makes women aggressive.
False.
They're just aggressive anyway, no, I'm joking. Low libido is just aging.
False.
If estrogen is normal, everything's fine.
False.
Women shouldn't use testosterone at all. We all know that's false. If you've made it this far into the podcast and you're still saying true, please go back to the beginning. Exactly. Why is testosterone in women still so controversial in medicine?
I think because it's misunderstood. And what happens in the medical profession is that you almost become blinded to your speciality or the way you've been taught. And it's that. So, I mean, when I was at medical school, we never learned anything about testosterone in female patients. We learned about estrogen and progesterone and oral hormone replacement therapy, and that was it. The word testosterone hardly ever never came into it. It might have been like a 5-minute discussion, right? There's so much more to it. And what's exciting now is because the longevity space is becoming such a big and interesting space right now, there's lots of evidence now to back up the benefits. And I think you've experienced it for yourself.
I have, yes.
We've seen it with hundreds of patients now as well that we've been treating on the platform. And it works, but once again, provided it's done correctly.
Yeah.
So it's not a one-size-fits-all approach. It's a tailored approach. It's looking at your blood results. It's looking at your symptoms. It's looking at you as a whole and the regular follow-ups and monitoring to ensure that you're getting maximum benefit using the least amount possible. That's actually sort of the key as well.
Sure.
So with time, I think it'll become a more accepted treatment. Less taboo. But it's amazing because people talk. So you have one patient that starts the testosterone and she sees and feels the improvement. She's going to tell all her friends.
Yeah.
And the next thing you know, it sort of spreads like wildfire. But as I say, the evidence is coming out now that provided it's done correctly, and I'm using I'm emphasizing that because it needs to be done correctly.
Like
it's not just
professional.
It's not just pulling something off the shelf and saying, there you go. It's tailored specifically for each patient. Then there are massive benefits to it.
Is there an age limit for testosterone therapy?
So
could my gran who's 84 start?
100%. So my mother who is now 74, right, is on testosterone therapy, right?
And when did she start?
She started 2 years ago.
Okay.
All right. Changed her life. All right. Her motivation's improved. Her energy levels have improved. She won't necessarily gain muscle mass, but she hasn't lost any more muscle mass.
Which is brilliant.
Brilliant. Her cognition's improved as well. So basically her mental focus, mental acuity's improved as well, because it's not just about muscle. There's all those other things as well that come with it. So there's no age limit to it.
So far, I'd say I'm an advocate for this because I think I've been a good starting case study so far. But I would also like to emphasize what you were saying. It has to be done correctly, the correct dosages in the correct environment. I think in this day and age, access to any kind of medication is far too readily available. And there's far too many underqualified practitioners that just hand everything out for a quick buck. I've had so many DMs on our Instagram asking for do we sell fat loss injectables? Like, yeah, no, just hop onto cosmetology, grab your GLP-1. And I know I keep going on to the same topic, and I'm not hating on it. There is a place for GLP-1s. There is a candidate for that. But my problem is that everyone is considering themselves a candidate.
Exactly.
And I just want to make sure that people listening to this also understand that not everybody is a candidate for testosterone, like you said, or any hormone replacement therapy. But if you are unsure and you are struggling with the symptoms that make you a suited candidate, go on to FemLabs if you're a female, go on to AndroLabs if you're a male. The process is so super simple. Fill out the questionnaire, get the blood results, go do your test. What gets measured gets managed. You need a starting point.
100%.
Take your blood tests. Let Dr. McAlpine go through it with you, with his team. If you've got any questions, if anything seems like out of sorts or whatever, or you're not feeling comfortable, ask. Ask. That's what he's here for. That's what his team is here for. If they don't know, they will get back to him and he will get back to you. But please, to all listeners, there's not a one fix solution for everybody. You know, we are all unique. We all have our own unique makeup. And it's very important that you listen to your body, you pay attention to your own changes, you understand what's happening, and don't just accept, I want to say deterioration very loosely. Don't just accept deterioration as part of the aging process and you just have to go with it. Oh, because I'm just getting older. So, yeah, I'm losing my hair, or, oh, it's fine. I don't care. I've already had 3 babies and I'm already married and who cares? I'll just be fat forever. Like, don't accept that. Don't accept that it's okay to feel tired just because you're older. You know, it's not acceptable.
100%.
Because there is so much readily available now to help you to be the best version of yourself, the optimal version of yourself, but in a safe environment. That's the biggest takeaway. Do your research. We have access to everything now. You know, don't just ask AI for answers. Question everything. Go and look for the clinical trials and research and find out for yourself and know your own body. At the Glow Up, we always talk about skincare and aging powerfully and gracefully. But energy is hormonal and muscle is anti-aging, which is what we've learned. And confidence can also be biochemical. Dr. McAlpine, if women take one message from this conversation, what should it be?
If you're in doubt, just get your bloods tested. Simple as that.
Absolutely. I mean, that really is quite
simple as that. If you've got any doubts or worried or just curious, just get your blood results done. And I say, if you do it through the FemLab platform, we even send a nurse to your home to come and pull the bloods.
I believe so. I should have opted for that.
So it really is super, super simple. It's all done online. It's not going to take a lot of time out of your day. Just get your bloods done and then you'll know.
Thank you so much for joining.
Thank you for having me again.
I'm definitely going to invite you back because I'd like to talk about peptides. That is
Great.
a big topic at the moment. And I know that you do offer some safe peptides already. And I think we should chat more about what is safe and what's not, how to identify the differences, and give us some insights into what's happening next in the wonderful world of what biohacking, if you want to call it that.
Call it that, yeah.
And to everybody listening, the glow up is not just topical, it is internal. Until next time, stay glowing.